Go for it.
So Mike Altman, I'm 44. I'm an Olympic rower from 2004 and 2008, and struggled with back pain my entire rowing career, which I thought was going to get better once I stopped rowing, but it actually didn't. Went to a series of doctors, chiropractors, orthopedists for 10 years after my retirement, and kept doing activities, and nothing was getting better. I was prescribed painkillers. Folks only looked at my back for years and years, and eventually it just kept getting worse. Finally, so as I said, I retired in 2008. Finally, in 2017, finally through talking to a friend of mine who's a doctor, we finally started to zone in on the hip. I went to orthopedic surgeon over at UCSF who found what I call a bone spur on top of the femur, which was causing damage to the labrum. Had a labral repair. That improved things, but I was still having issues. I was still having the lower back issues that had plagued me the whole time. Started physical therapy again a year after the surgery. Went to Healthwell Physical Therapy. Started working with Greg Minnis, who realized I was just having a lot of irritation going into any sort of hip flexion. And so that was really good to finally get a name to what was going on, and that's when I got referred to Dr. Paul. Sorry to refer you in third person, but video. Referred to Dr. Paul for some injections. We did a series of, he did some diagnostic tests, decided he could help me with the PRP injections. So we did a series of injections, which really started to help. As soon as the needle went in, I could tell we were at the root of the problem. As soon as I started touching on those particular areas, Dr. Paul referred me to his colleague Brian Hanna over at Muscle Activation Therapy, who we figured I would get better, but figured he could retrain some of the muscles that have been shut down. Sat on Brian Hanna's table, and within 30 minutes of checking me for functional movement, he found a rib that hadn't healed properly, that had been a stress fracture that I'd been carrying around for 15 years, and turned out, take that back, it wasn't a stress fracture, it had actually been broken and it had mishealed. So he was able to work on the scar tissue around that. But realized I was way out of alignment, started over a series of sessions, started popping all of my ribs back into place and fixing some of the other muscles that were out of alignment in the hip and the leg, all the way down. Had me working with his colleague, Savannah Hine, to start getting my abs and core working. And once those started working, it took a long time and a lot of concentration, but I finally started feeling the core for the first time in my life. Now I've got much more movement than I ever thought possible. I can show you is what I'm doing right now with my foot here. About 2 months ago, I could only turn it about that far. I only had about that much movement. Now I can easily do this, which was just not an option for me here. It was just stuck right here. Just freed up my whole, this whole area, which was compressed and in a lot of pain. I recently, I'm still working, I'm still rebuilding some of those muscle memory, getting some activation going, but I recently sat on the rowing machine just to take a few strokes to see and interestingly, I found that I could press more cleanly and more flush with my leg drive than I ever could when I was competing. It was always lopsided towards one side. So that was kind of a shocker to me. So here I am, getting much better, and looking forward to actually getting my life back.
Awesome. Thank you very much.
Yeah. Anything else?
That's good.